Hello, and thank you for joining our webinar on how the 2020 election will impact health benefits. I'm Reagan Corliss, and I manage marketing for both Journey and MedSavvy. Our 2021 webinar series is hosted by MedSavvy and Journey, subsidiaries of Cambia Health Solutions. These educational webinars are designed to offer HR executives both SHRM and HRCI credits. As a nonprofit total health solutions company, Cambia strives to be a catalyst for change, creating a more person-focused and economically sustainable healthcare system. Cambia's team of legislative and regulatory policy professionals are joining us today to discuss how federal policies might affect employee health benefits, programs, and services. As a brief introduction, Journey is an employee benefit that is a first of its kind health management platform that makes it easy for employees to cost effectively take full advantage of their health benefits by bringing all their healthcare needs into one place. Employees can utilize our self-service tools, health and well-being expertise, human support when, where, and how they need it most. MedSavvy is a unique medication management service that has been significantly making a difference at helping both employees and employers save on their medication costs. MedSavvy incorporates the human touch with technology through virtual pharmacist consultations who utilize technology to provide medication costs and grade comparisons, alerts on cost savings, recalls, and other medication safety issues. MedSavvy is available as part of the Journey platform as well. As a quick overview, over the last year, the HR executive role has become indispensable to the corporate strategy, health, and success of organizations worldwide. CEOs are now pulling in HR leaders as key strategic advisors. And along with increased responsibilities, these unprecedented times are expanding your roles and presenting new challenges for HR teams. As the new administration introduces new healthcare priorities, it's essential for HR professionals to understand the changes and prepare for the impact they may have on your healthcare benefits. To introduce our speakers, we have Allison Esquia. She's Vice President of Federal Affairs for Cambia Health Solutions. Allison is responsible for guiding a federal team of legislative and regulatory policy professionals, a political action committee manager, and external consultants to execute on Cambia's business objectives and strategic initiatives. During her career, Allison worked on the pharmaceutical industry as well as in 2 large government organizations, and she has served 3 U.S. senators. Oliver Kim is Director of Federal Affairs for Cambia Health Solutions. Oliver supports Cambia's proactive federal strategy to advance the company's business objectives with government and non-government audiences. During his career, Oliver served as Senior Legislative Counsel to a U.S. Senator and as the Deputy Director for a U.S. Senate Special Committee. He has presented internationally and has been published in legal journals with Harvard, Rutgers, Dalhousie, Northeastern, and Southern Illinois universities. So Allison and Oliver, I'm handing it over to you.
Hi, everyone. Thank you so much for joining us today for the election's impact on health benefits. We're going to talk about how the election really affected what policies will be addressed by the administration and the new Congress. So with that, let's get started. Today, Oliver and myself will provide an overview of the 117th Congress. We'll walk through some of the key players and priorities of the Biden administration. We'll walk through a host of healthcare issues that we know are on your minds as you're trying to think about what could happen this year and next year. And also we'll talk about some digital health issues that we think will be something that you'll be paying attention to over the course of the next year. So we're going to begin talking about the overview of the 117th Congress. This chart includes both the electoral and the popular votes for Joe Biden versus Donald Trump. As you can see, Biden has 306 electoral votes compared to Trump's 232. To win the Electoral College, a candidate has to receive 270 or more votes. So now that we've talked about the presidency, let's talk a little bit about what happened with the Senate. Leading up to the election, control of the Senate really hinged on the outcome of 7 races in 6 states. Those states were Georgia, Iowa, Maine, Montana, North Carolina, and South Carolina. After the election, it became clear that the balance of power was dependent on runoff elections in Georgia. On January 5th, Georgia held those two runoff elections, which were won by Democrats John Ossoff and Raphael Warnock. The races meant that the US Senate would be evenly divided with both 50 Democrats and 50 Republicans. However, Democrats are considered the Senate majority as a result of President Biden winning the election and Vice President Harris's status as the president of the Senate, who provides the tie-breaking vote when needed. You can also see from this chart that Democrats have maintained their majority in the US House of Representatives. But with that said, they'll have the thinnest majority the House has seen in the past 20 years. As of now, Democrats are leading with 222 seats to Republicans' 212. 218 seats are what's needed for control of the House. So as the 117th Congress gets up and running, we wanted to spend a little time to acquaint you with the Health Committee leadership. But before I do that, I want to spend a minute talking about congressional leadership. With the Senate flipping, Republican Senator McConnell from Kentucky will transition from the majority leader to the minority leader. Democrat Senator Chuck Schumer from New York will similarly transition from minority leader to majority leader. In the Senate, that means Democrats will become chairs of all committees. There was not many leadership changes in the Democratic or Republican side of the House of Representatives. Speaker Pelosi, Majority Leader Hoyer, Majority Whip Clyburn, Minority Leader McCarthy, and Minority Whip Scalise are all returning to their roles from last Congress. It is important to note, however, that Speaker Pelosi stated in 2018 when she reclaimed the gavel that she would remain as Speaker through the 117th Congress, giving way to a new Democratic leader in 2023. So this slide really walks through the leadership of committees of jurisdiction in healthcare. And what is really important to take note of is that there's new leadership in 3 of the 4 healthcare committees. The Senate Finance Committee will have Chairman Ron Wyden from the Democratic side of the aisle, but it'll also welcome Senator Mike Crapo on the Republican as the new ranking member. This committee has jurisdiction over Medicare, Medicaid, CHIP, and tax issues. The Senate Health Committee has Senator Patty Murray, who will be returning as chair, but it will have a new ranking member in who we likely expect to be Senator Richard Burr. Senator Alexander from Tennessee recently retired, and Richard Burr is expected to be the new ranking member on the Republican side. This committee has jurisdiction over a lot of public health, FDA, and prescription drug issues. In the House, there's also new leadership at the Energy and Commerce Committee. Chairman Frank Pallone will be returning as the Democrats' leader on the committee. However, Congresswoman Kathy McMorris Rodgers from Washington is going to be the new ranking member of the committee, filling a slot that was previously filled by Greg Walden, who retired. The Ways and Means Committee is the committee that has the least amount of change in the healthcare space. Both the ranking member, Representative Neal from Massachusetts, the chairman, Representative Neal from Massachusetts, and ranking member Kevin Brady from Texas will be returning to their roles. Similar to the Finance Committee, this committee has jurisdiction over Medicare and tax issues and a few other healthcare issues as well. So I just mentioned the wins from Democrats in Georgia, giving the Senate control to the Democratic Party. So the question then becomes, what does this nominal Democratic sweep actually mean? First, flipping the Senate makes it easier to confirm President-elect Biden's nominees, as only a majority vote is required to approve nominations. In the healthcare space, this means that Javier Becerra for HHS Secretary is likely going to be an early and easy confirmation. Second, flipping the Senate increases the likelihood that significant legislation, and that's particularly related to healthcare, could be passed using the reconciliation process, which only requires a majority vote in the Senate. We don't yet know if President Biden will want to move COVID and economic stimulus relief or possibly Affordable Care Act provisions through reconciliation. but it's not a slam dunk process. Healthcare policies that are attempted through reconciliation require offsets, and Democrats could certainly look to many of the drug pricing policies to help offset the cost. Other offsets could be imposed, like new taxes or Medicare rebasing or market basket changes. We just don't know yet. Third, the new Democratic-controlled Congress really opens up a lot of the Trump administration rules and regulations to something known as the Congressional Review Act. These challenges could occur early in the new Congress, and it could be a tool for the incoming Democratic majority to overturn certain rules without needing to go through the Administrative Procedures Act. But finally, the Democratic sweep essentially puts the administration, Speaker Pelosi, and Leader Schumer in charge of setting the policy agenda for the next 2 years. Not every Democratic priority is going to pass, and on many issues, there are divisions about what would constitute a Democratic priority, but the ability to set the agenda and prioritize certain issues over others is significant. What I will say is that congressional majorities are razor thin. We do expect the legislative filibuster to remain. There's also the chance that Congress could focus on legislation that has bipartisan support. That could include additional COVID-19 relief, prescription drug prices, digital health access, and health disparities. Further complicating issues is House Democrats recently voted on impeachment of President Trump over his role in inciting a mob that led to the deadly assault on the Capitol building. With the Senate in recess, any trial for impeachment cannot begin until January 20th at the earliest. Once a trial is underway, the Senate is not allowed to take up any other business, including Biden's cabinet nominees or other high priority legislation. There's talk of exploring potentially a bifurcated process to allow the Senate business to be conducted. There's also the possibility that the House could delay sending the articles of impeachment to the Senate. We don't yet know which approach is going to win the day, but there's a number of things that are up in the air with this process right now. Biden has treaded carefully, saying that impeachment is a matter for Congress to decide. For the 117th Congress, we anticipate the pandemic will continue to overshadow all aspects of health policy in the short term. Healthcare legislation, in turn, will compete with other Democratic priorities, including the economy, tax reform, climate change, immigration, gun safety, and worker protections. So although Democrats control the House and the Senate and the White House, with narrow majorities in both chambers, it's unlikely sweeping legislation is going to be enacted in the 117th Congress. Even so, there really is intense interest in healthcare generally and COVID more specifically. Several independent drivers and must-pass legislation could become vehicles for other healthcare issues, such as Medicare trust fund pending insolvency in the next 3 to 4 years, expiration of the sequester relief, expiration of the debt limit extension, the Supreme Court ACA decision, and the end of the fiscal year on September 30th. This chart really outlines a number of those forcing mechanisms and key actions that I just talked about. They're going to influence the work of Congress over this calendar year. As I previously mentioned, we expect COVID relief to be a major part of the congressional agenda, particularly early on. You'll also see that cabinet confirmations will take up an early part of Congress's work. We also anticipate reconciliation being used to pass legislation. I mentioned this term a little bit earlier, but I want to go into a smidge of a deeper dive with you right now. Under the reconciliation process, Congress must first pass a budget resolution that contains instructions to all of the committees of jurisdiction that orders them to find a certain amount of savings or a certain amount of revenue. The committees then get to work producing legislation. They send it to the budget committee, and then it goes to the Senate floor for consideration. These reconciliation bills have really strict rules and time limits for debate. And most importantly, this legislation only requires a simple majority vote to pass in the Senate, and any tie could be broken by Vice President Kamala Harris. We're expecting 2 reconciliation bills this year. If one is not needed for COVID and stimulus, then one package could be for a non-healthcare priority, such as climate change or infrastructure. Another reconciliation bill could address health and tax issues, including things such as drug pricing, ACA and Medicaid reforms, tax changes to narrow the federal deficit. There's a potential for a 3rd reconciliation bill that could happen in 2022. So now I'm going to turn it over to my colleague Oliver, who will go through some of the key players and priorities of the Biden administration. Take it away, Oliver.
So following on Allie's point about the change in the Senate, Joe Biden has announced most of his cabinet picks. It's one of the most diverse cabinets in terms of the number of women and people of color taking on some historic opportunities. One example is Deb Haaland being the first Native American woman to take over the Department of Interior and how that will shape Native American issues. But again, from a process point, having that control over the Senate, even though it's nominal 50-50, it will make it more likely that many of his cabinet picks will be confirmed. While not all of his nominees have been named, all the major cabinets, including the Health and Human Services Secretary, the Labor Secretary, and the Treasury Secretary, who all have key roles in health benefits, have been named. Mostly, we're going to be focused, though, on people in the Health and Human Services Department. So here are the key people who have been named to the health department. As you'll know, most of these people have a large role in public health. This is because the president-elect has really focused on COVID as his top domestic priority. And so we see here, for example, the head of the CDC has been named, but we haven't seen yet names to the Centers for Medicare and Medicaid Services, which has jurisdiction over Medicare, Medicaid, and the ACA plans. We haven't seen yet a nominee for the Food and Drug Administration, which will have regulatory authority over not only vaccines and therapies for COVID, but also just our everyday drug needs and generic approvals. But you'll see there's a huge focus on people who are going to help us deal with the upcoming pandemic. Many of these people will also be serving in the White House, showing how important this issue is to the incoming administration. So these are some areas, it's certainly not exhaustive, but that we believe are going to be top priorities, and we're going to delve in deeper onto many of them. But just some things that we think you should focus on and think about in the upcoming year. Obviously, as we've stressed numerous times, COVID is going to be a top issue. Other issues are going to be putting some changes on regulations that have gone out on the ACA and trying to work with Congress to the extent that legislation can get through on making improvements to the ACA. Medicare and Medicaid are going to be huge issues, including trying to ensure the solvency of Medicare. And then other more discrete issues include health equity, mental health, prescription drug pricing, and digital health. So we will focus on those in turn later in the presentation.
Thanks, Oliver. We're going to move on to some of the healthcare issues that we've just outlined for you. So before we talk about where we're going, I thought we would take a minute to reflect on where we've been. And as we were about to say officially goodbye to 2020, Congress passed substantial year-end legislation that included a $1.4 trillion bill to fund the federal government through fiscal year 2021, a COVID-19 relief package, protections from surprise medical bills, and a number of health-related provisions. So the fourth COVID relief package totaled $900 billion. It had funding for COVID-19 testing and vaccine distribution. It extended unemployment benefits and small business aids and included another round of direct stimulus checks. Notably, the package did not include aid to state and local governments, nor liability shields for businesses. So if we dig in a little further, the package included about $29 billion for vaccines and distribution, $22 for COVID-19 testing, tracing, and mitigation efforts. The package also included $120 billion in enhanced unemployment insurance benefits to provide an additional $300 a week. It provided funding for the Paycheck Protection Program and expanded the kinds of businesses that qualify for forgivable loans and grants. It provided up to $600 in stimulus checks to individuals earning less than $87,000 a year. And it also provided rental assistance, an extension of federal eviction ban, funding for food assistance, and transportation aid that was intended for airlines, airports, mass transit, state highways, and Amtrak. So that was the bill that just passed in December. However, another COVID bill is going to be a top priority for the new Congress, and President Biden has already signaled his strong desire to enact additional funding and relief quickly. President Biden has called for legislation that includes extended and enhanced unemployment benefits, an increase in personal stimulus payments to individuals to up to $2,000. He's called for hundreds of billions of dollars in aid to state and local governments. He's called for increased funding for Medicaid, more payments for local schools, rent forbearance, additional help for small businesses that are really hard hit, particularly restaurants. And it's also likely that a final package will include billions for vaccine distribution and logistics, outreach and education, with a focus on minority and nursing home communities that have been especially hard hit. We expect it will include support for clinical providers and possibly additional funds for the public health data systems necessary to coordinate an effective vaccine strategy. Two additional items that may ride along in this COVID package include the Medicare sequester relief for healthcare providers that currently expires at the end of March, and temporary legislative flexibility to continue to provide telehealth under federal rules. If the package is paid for, it could include policies to reduce the prices of prescription drugs. It could include some Medicare Advantage cuts, and it could include maybe some repeal of Trump administration rules like the rebate rule, which we'll discuss later. It's likely that a bill will move quickly, perhaps signed into law in Q1 of 2021. The initial intentions really seem to be to move this through regular order, requiring a 2/3 vote in the Senate and not reconciliation. But this could change if an agreement cannot be achieved. Because Senate Republicans have really begun to profess fiscal concerns, because Congress has already supplied more than $4 trillion in COVID assistance, and the deficit is slated to top $3 trillion this year, it's likely the bill will be less robust than the Democrats may hope for, just so it can secure passage. Budget reconciliation will serve as the backdrop if nothing is agreed to, and that could add to the complexity and the time to the process compared to just passing a simple spending bill. We expect robust administrative action, and possibly invocation of the Defense Production Act on PPE, testing, vaccines, and treatment. So another thing that happened in December as part of that year-end spending bill was, after years of debate, Congress reached a deal on surprise medical billing. Starting in 2022, the No Surprises Act will ban surprise medical billing for consumers who seek emergency care, are transported by air ambulance, or those who are unknowingly treated by an out-of-network provider at an in-network hospital. So you go to the hospital and maybe the hospital's in network, but the anesthesiologist that you saw was out of network. It's those kinds of situations that this bill will apply to. Essentially, consumers will only pay the deductibles and co-payment amounts for an in-network service or visit. There are circumstances where balance billing will still be allowed, and that's if certain consent and notice requirements are met. We outline those here on this slide. They have for example, the out-of-network provider would have to provide written notice that talks about their network status, offer a good faith estimate of what they will charge, and they'd have to provide that notice 72 hours before the appointment was made. And then only then, if the patient gave their consent, would they be allowed to be balance billed for the service. So to solve the billing disputes, the legislation creates a whole new system that would create a 30-day open negotiation period to settle claims. If resolution is not achieved, then they proceed to a binding baseball-style arbitration where one party would prevail. Providers and insurers would submit their offers to an independent arbiter, and that arbiter would then choose the final payment amount based on median in-network rates, among a host of other factors. It's important to note that that arbiter cannot consider public payer rates. So rates like Medicare are not something that they can consider, and those rates are typically lower than private insurance or bill charges. The Trump administration is going to begin drafting regulations on this soon. You can see on the left-hand side, we talk about the law goes into effect January 1st, 2022. Many provisions will need to be implemented through regulation that are required to be issued by summer and fall of this year, 2021. And a lot of the agencies, so HHS will have some role, but we really believe that the Department of Treasury and the Department of Labor will be also very involved in issuing the regulations to implement this provision. On the right-hand side, we walk through some of the consumer provisions that are included. I already talked about that 72-hour notice and consent piece that has to be provided for consumers so they can be aware of potential balance billing situations. But there are others too. Health plans are required to include both in-network and out-of-network cost-sharing amounts on their ID card. Healthcare providers have to provide estimates on what services could cost up to 3 days in advance. Health plans are required to provide an advanced explanation of benefits containing information about the providers, their network status, and estimated cost at least 3 days ahead of scheduled services. One other thing I wanted to share is that the legislation requires health plans to offer a price comparison tool for consumers. That has to start by January 1st, 2022. The tool must allow individuals to compare the amount of cost sharing that they would be responsible for each participating provider and each specific service that they would be receiving. So there's a lot of consumer provisions that are also included in this bill that go into effect by January of 2022. So I'm going to move on from surprise billing and kind of walk through some of the healthcare coverage issues that we anticipate to dominate the agenda over the next Congress. The items on the left are really some of the issues that we expect to go through Congress. The ones on the right are ones that we expect to go through the administration. The top line message of Biden's healthcare plan is that his administration really intends to protect and build on the Affordable Care Act. And that's instead of starting from scratch and just getting rid of private insurance. That's never been a part of his platform. He's always talked about how do we go about, in his words, protecting, building, strengthening upon the ACA. The major policies that are included in his health plan will require legislation. The likelihood of that legislation passing is really reduced by the nominal Democratic majorities. But as we talked about, there are opportunities where some legislation could pass through reconciliation with just 50 votes. In general, the Biden plan really emphasizes increasing the number of individuals eligible for ACA marketplace subsidies and also increasing the generosity of those subsidies. Policy elements include removing the current prohibition on subsidies for those with incomes over 400% of the federal poverty level. Instead, subsidies would be provided to all individuals. Marketplace coverage would cost no more than 8.5% of your household income. And in many cases, it would be less than that. Also, Biden proposes that the amount of subsidies would be based on a gold plan rather than the current less generous silver benchmark plans. While the Biden administration's regulatory plans have not been outlined in great detail, we do expect those plans to include some marketplace operational changes, including expanding the open enrollment period, which the Trump administration significantly shortened, increasing funds for marketplace outreach and the Navigator program, which also the Trump administration had reduced. Of direct significance to employers, the Biden plan calls for removing the current prohibition, also known as the firewall, on marketplace subsidies for employees with offers of employer-sponsored coverage. The potential removal of this prohibition would also have a direct effect on the employer mandate unless the basis upon which the penalty is imposed changes. Currently, the employer mandate is based on the number of full-time employees who receive marketplace subsidies. This would likely need to be changed, or employers could face the prospect of paying a penalty even if they offered coverage that meets ACA standards. And you'll note another component of Biden's coverage proposal includes a public option. It's a new federal public option that would be offered to any and all individuals through the ACA marketplace. It would also be offered to employees and their families who have access to employer-sponsored coverage. In his proposal, the option would negotiate prices with providers and would be provided to some without cost in states that did not expand Medicaid as allowed under the ACA. Relatedly, we expect Democrats to continue to push for a Medicare for all strategy, especially in the House. However, it's really highly unlikely, given the narrow margins and the opposition within the Democratic caucus to those proposals. A public option, much like Biden has proposed, could be in play, but it's hard to see how it could overcome the 60-vote opposition in the Senate. And it's also hard to see it be included in any kind of budget reconciliation bill because it could violate some of the budget rules in that process. So we could see remnants of the public option in other administrative policy initiatives or as part of future congressional negotiations. We may see efforts at the state level to create public options, and that's already been done in Washington state as a way to expand coverage. I wanted to mention one thing not on this slide is COBRA. Biden has supported the federal government covering 100% of the cost of keeping workers who lost their employer-based coverage with COBRA subsidies. This faced a lot of opposition in Congress last year over disputes of application of the Hyde Amendment about abortion funding restrictions to those with COBRA subsidies. It's not entirely clear what could occur with COBRA subsidies in the new Congress, but we do expect continued attention to this issue, as well as policies that more generally enhance the ability for individuals to get coverage on the individual market. On the regulatory side, we expect a Biden administration to explore a few other health coverage policies. Number one, we expect them to expand open enrollment, the duration of it, by reversing a 2017 change that shortened the annual open enrollment period to 45 days. We expect them to provide more generous special enrollment periods so individuals could enroll regardless of a qualifying event. We expect them to reverse the Trump administration spending cuts for health navigators and marketing and outreach. We expect the Biden administration to also maintain access to healthcare.gov and strengthen the standards for web brokers. We also expect the Biden administration to reverse a number of Trump administration policies, one on short-term limited duration insurance plans. As you guys probably are aware, the Trump administration expanded the maximum duration of these policies from 3 months to 3 years. Anyone in these policies knows they're not subject to the ACA rules. We think the Biden administration will reverse that. We expect an incoming Biden administration to reverse Trump administration standards for association health plans. The Trump administration expanded the ability of small employers to join together and offer health insurance as an association health plan. And these regulations have been the subject of ongoing litigation, and we think the Biden administration will come in and revise these rules. We also expect the Biden administration to reinstate the Obama administration Section 1557 anti-discrimination protections. The Trump administration amended them to eliminate the general prohibition on discrimination based on gender identity and sex stereotyping and specific health insurance coverage for transgender individuals. So moving on to another key topic area for this Congress and administration is in the top of Medicare and prescription drugs. These are some of the policies that we anticipate being debated over the course of the next year. Medicare is projected to become insolvent in 3 to 4 years, and Congress typically acts to shore up trust fund finances when insolvency dates get close. So we expect that Medicare insolvency to become a catalyst for a host of other Medicare reforms. Democrats could push for certain Medicare benefit expansions, including hearing, dental, and vision. We saw them push for these policies last Congress, and we expect them to continue to do so this Congress. It's difficult to see how hospitals and other providers could be cut because of the ongoing pandemic. But there are certain items that could be on the table for reform as a way to help shore up the trust fund insolvency. Congress could look at nursing home payments, quality and staffing requirements, risk sharing models, and a host of other payment policies. We also believe that a bevy of tax increases and drug pricing and payment adjustments could become a large part of the conversation involving Medicare trust fund insolvency or potentially deficit reduction. Biden has also called for lowering the Medicare eligibility age from 65 to 60, and he would allow those who prefer to remain on their employer plans to do so, and he would also prohibit employers from excluding older workers from coverage. I think this is a policy that could continue to gain a lot of discussion and traction this Congress, and it's one that has probably more of an ability to be considered than some of the other, Medicare for All-like policies that we talked about previously. Perhaps the greatest industry at risk of reforms this Congress is the pharmaceutical industry. really everything is on the table in the drug space. There's been a number of policies that have been proposed over the past few years that we think are still going to be considered this Congress. Everything from restructuring the Medicare Part D benefit to inflation rebates to international reference pricing. There's a lot of things on the table. We'll talk about a few of those. I also think there could be some FDA reforms on the table that are really aimed at preventing any kind of perceived drug gaming that could occur, evergreening patent thickets, orphan drug status, etc. Biden's healthcare plan really includes a proposal about Medicare negotiation. And what does that really mean? It's about targeting those excessively priced prescription drugs that don't have really any competition and creating an independent review board to evaluate and recommend pricing parameters for those drugs. It gives the Secretary of HHS the authority to negotiate prices that would be capped to a level that's associated with an average price in other countries. That negotiated rate would then apply to Medicare, and this is also important, it could be available to private plans in the group and individual market. Without the legislative authority for HHS to negotiate prices, it really remains unclear what kind of regulatory actions the administration would pursue to try to achieve this objective. It's unlikely that a Medicare negotiation policy would be passed by Congress because of the 60-vote threshold. It's not likely to be something that would qualify for a 50-vote reconciliation vehicle. The other policy that has been talked about in the prescription drug space is about the international indexing or pricing of drugs. The Trump administration proposed a rule to lower the cost of Medicare Part B drugs and biologics by capping payments that manufacturers receive based on what's available in other countries. It's called the most favored nation rule. It's been enjoined by the courts. It's been remanded back to HHS, and it's going to be going through some regulatory procedural remediation. The future of the rule is uncertain. The Biden team will likely want to put their own stamp on it, and we could see a different model kind of emerging in that space. And the last one on this chart is about the drug rebate rule. The Trump administration finalized the rebate rule, and that requires that the full value of PBM negotiated rebates for Part D drugs be applied directly at the point of sale. CBO, the Congressional Budget Office, previously estimated that this rule would result in a $177 billion increase in federal spending over the next decade. They also estimated it would increase Part D premiums by as much as 25%. There appears to be a lot of concern that if this rule is retained, those premium increases could start to give really sticker shock, and the Biden administration is concerned about it as well. We expect the incoming administration and the new Congress to try to repeal this rule. It's also possible that lawsuits could occur and prevent the rule from going into effect as well. So it's another one that is hanging out there with a little cloud of uncertainty right now in the prescription drug space. I think with that, I'm going to pass it on to Oliver to talk about mental health parity.
The next area that we wanted to highlight is behavioral health, and this is a key area in two major respects. First, I just want to point out we're actually living under two federally declared public health emergencies, obviously one for COVID, but the other one is we are still living under a public health emergency to deal with the opioid epidemic. And even though that may have faded from the headlines, it's still a very critical public policy issue that people on Capitol Hill and you might also be grappling with too in helping your employees. Second, mental health has just become more of a resonating policy issue because, again, because of COVID. I mean, as well as other external factors. I mean, a lot of us are living in isolation. There's been a lot of concern about the tenor of our politics, and many of us are just feeling apprehension and anxiety due to, fears about the status of our job, our economy, and our community's resilience. So some of the COVID recovery packages that Ali discussed before have included much needed funding for our mental health care system. And there is also a executive order out to look at ways that the federal government, that the agencies can be doing more to increase behavioral health services. But this slide describes something in the end of the year package that Ali mentioned earlier that will put more reporting requirements and compliance on health plans to see how they are meeting their requirements under the federal mental health parity mandate. So under this new reporting requirement that's described here, plans will have to do a comparative analysis of their non-qualified treatment limits for their mental health and their substance use disorder benefits. You may be familiar a little bit with this because your state may require plans to be doing this already. Now it'll be a federal requirement sent up with this information sent up to the Labor Department, which is supposed to do an analysis for compliance and enforcement. And this information is supposed to be publicly available. Now, of course, this just passed at the end of the year. A new labor secretary will be coming in. So even though this requirement is supposed to be going into effect, we'll have to see, some more details on how compliance will be measured, how the reporting will be publicly available, and some of those process points. But this is something that will occur in 2021. Another area that we definitely wanted to highlight for you is the renewed focus on health equity, both as a consequence of some of the failures in the healthcare system to respond to the COVID epidemic equally and equitably across all communities, both communities of color, rural communities, and seeing some of the health disparities in the pandemic's effect on different communities. Additionally, obviously, the civil rights demonstrations that occurred this summer in response to George Floyd and other incidents have really placed focus on how we can think about equity writ large across all policy issues. Again, obviously equity needs to be embedded in everything that we do in terms of decision making, but we wanted to highlight a few key areas that are ongoing that will likely see both legislative and regulatory action over the upcoming year. One, there'll be definitely a focus on access to coverage. So thinking about how the ACA, how Medicare and Medicaid can be more responsive to different communities. Maternal health is a huge issue with the crisis in maternal mortality, particularly among the Black and Latino communities. Immunizations, one, of course, how the COVID vaccine is dispersed and distributed, also trying to deal with some of the very real negative historical concerns about treatment of the Black community, Native American communities by healthcare providers, trying to address some of those concerns and making sure that the vaccine is given out smoothly and efficiently in an equitable way. Behavioral health, again, is a key issue, as I just mentioned, but there are definitely lower take-up rates in communities of color, and trying to assuage some of the negative stereotypes about seeking behavioral health care, particularly mental health services and counseling. And finally, one area, policy area is just dealing with the workforce, making sure that our healthcare providers reflect the patient community that they're representing. So how to get more people of color into different roles as clinicians, as providers, but also looking at the C-suite and making sure that there are diverse voices in decision-making capacities. The other one to know and to mention that you may see more of is there is going to be more of a focus, both internally and externally. People are going to look more at measurement tools. How are we actually achieving these goals of equity? So you may see more focus and more attention by plans on if they're meeting certain metrics. So expect to hear more on how measurement is and metrics are being used in achieving equity. So we want to take a moment here to take a deeper dive into pending digital health issues. And digital health can mean many things to many people. It could run the gamut from AI to wearables to telehealth. It also encompasses many policy and legal issues such as privacy, security, and connectivity. So what we wanted to do here is provide a snapshot of recent developments so you have a sense of what's happening and what's going to continue to happen despite some of the political changes. A lot of these issues are very bipartisan, so we expect them to continue regardless of some of the political leadership. The other thing that we want you to take away from this is the technology is moving much faster than the law and policy can keep up with. We don't have a general privacy law over data, and the federal health privacy law, HIPAA, those regulations that govern health data and how health providers treat that data, that's decades old. So the current Trump administration has made some regulatory changes to make it easier for patients and providers to share data so that care is more seamless, but current law limits the extent to how far regulations can go. So we're going to have to see with all these pending policy priorities that Ali mentioned earlier, COVID, the economy, will Congress be able to find time to sort of address some of the different small partisan, I shouldn't say small, but different partisan concerns in order to make changes in privacy law? So one of the big changes that occurred and will continue to occur is ensuring greater interoperability of healthcare data. So that's so that your doctor can talk with another clinician, so that hospitals can exchange data. And even though we've been working on this issue at least since 2009, when Congress provided a lot, billions and billions of dollars for doctors and hospitals to use digital health records, COVID has shown a spotlight on why it's so important for people to have meaningful access to their data and be able to share it with their providers and with their payers. I found myself in the same boat where my doctor is still trying to fax data to my primary care provider. And so it really should feel like it's easier. Last year, CMS put out a regulation that is supposed to make things easier by requiring payers and other stakeholders to use APIs. That's an application program interface. And those are tools that allow different entities to communicate with each other via applications. So if people are using the same APIs, the payers and other payers or payers and providers should be able to talk to each other. APIs are super common. We have tons of them on the websites, in your phone. This allows you to shop online, to sign up for things. So they're not foreign to to other aspects of online life. So this slide shows how we're beginning to make APIs more common. One part of the regulations on interoperability were set up by the Centers of Medicare and Medicaid Services. And through this system, the APIs will help guide exchanges using certain standards, for example, FHIR, the standard, so that exchanges are done more quickly and more securely, and payers can require APIs to attest to certain privacy standards before exchanging data with them. This also should help consumers and patients have greater ability to share info and to find information like provider directories so that they know who is in and out of network. And they'll also have greater control over their data if they move from one payer to another and be able to require their old payer, their old plan to share claims data with their new plan if they shift during open enrollment. A second rule was recently issued. In fact, it was issued the same day that we're taping this webinar, that builds on this interoperability rule for a certain number of plans, and we expect that this expansion will be included for other plans, including Medicare Advantage, to encompass more payers and plans over the upcoming year. Additionally, a sister agency, the Office of the National Coordinator, put out a second part of the interoperability rule. This is to develop both a set of standards, a common language for the app developers to talk to each other, as well as a definition for when apps or providers improperly try to restrict the flow of data. So these standards will allow people to access digital records even though the records were created in different systems or platforms. It's like how Droid and Apple phones can talk to each other, or how you can use an ATM in a different country, despite language and currency differences. Additionally, this slide notes there are certain times when a provider, payer, or other entity could block the flow of data. Those circumstances could include, fraud or concern of improper use by the recipient. But Congress did hear a lot of concerns about information blocking, where a provider wouldn't share a patient's data for commercial or proprietary reasons, not because of the patient's benefit. So there are a set of rules identifying when such information blocking can be penalized if done for the wrong reasons. Of course, these changes won't happen immediately or overnight. They're going to take a lot of time and energy to implement. Because of COVID, the federal government is delaying some of the requirements, or delaying its enforcement of one of the requirements are supposed to go into effect. So depending on how long and how severe the pandemic continues to be, there may be further delays, but these changes are coming and there is strong bipartisan interest. One of the silver linings of COVID, if you can say that, has been the rapid advance of telehealth. Telehealth, of course, is not a new technology, but it's seen renewed interest and activity given the pandemic and the need to social distance. During the public health emergency, the federal government has waived many existing requirements that pose barriers to patients, providers, and payers in utilizing telehealth. So the main obstacle has always been, under existing law, Medicare will only pay for telehealth services if the patient is located in certain settings and in a rural area, and if those services are performed by certain providers. But as part of the different federal relief packages to combat COVID, Congress authorized the Department of Health and Human Services to waive a lot of these barriers. And additionally, HHS has waived some other aspects, for example, HIPAA, to allow providers to use certain non-compliant platforms in order to communicate with patients during the pandemic. So thanks to these waivers, patients can see providers at home or in the office or wherever they might be. And sometimes, different people may have challenges using a video chat on their phone or computer. So the waivers have allowed some audio-only interactions with providers. And additionally, there's been flexibilities with health savings accounts and waiving some copays. And again, as I mentioned, because Medicare is such a big player and payer in the healthcare system, these changes have had downstream effects on other payers. So you've likely seen changes in your benefits for your employees. And even though we're seeing more providers reopen their offices and more patients going back to clinics for care, we definitely expect to see telehealth continue. The big question is whether the law will go back once the pandemic is over, or whether some of these changes will be made permanent for the future. There's been some fiscal concerns about making some of these changes permanent, so we'll have to see whether Congress is willing to overcome those, or make some changes permanent while allowing others to lapse. But this is probably the key time to see some of those changes made. Another area that we wanted to spotlight of bipartisan interest is price transparency. We're trying to give customers more meaningful information on prices for services so that they can make the best choice for their healthcare needs. Of course, what is the right information can be a matter of debate, but we are very excited about the opportunities that transparency offers us to empower our customers. We've definitely been at the forefront at offering customers tools to make smart choices. This slide describes some of the changes that have happened late in 2020 when the federal government released a transparency rule that applied to most, but not all payers and plans. And these requirements will provide customers with more information on a set list of shoppable services that can be captured via, again, those APIs and used in applications for consumers to see what a service costs. Plans will also have to provide tools so that consumers can understand their cost sharing requirements. While the rule was made final late in the last quarter of 2020, we do expect some things to possibly be changed by the incoming Biden administration, particularly as they try and implement some of the provisions from the No Surprises Act that Ali talked about earlier in concert with some of the transparency and interoperability provisions. Lastly, we did want to put in a note about how the federal courts play a role in shaping public policy. The courts, of course, are a reactive branch of government. Someone actually has to put a case in front of a judge. They don't go out and seek changes as Congress and the White House do. And while we aren't necessarily the right people to talk about judicial rulings, we do look at the political and policy impact of case law as they impact our work in advocacy and policy. So the one case that we did want to highlight is a case before the Supreme Court called California versus Texas. It's the latest challenge to the constitutionality of the Affordable Care Act and whether a part or all of the law should be struck. This case was heard before the Supreme Court last November, and we don't expect a decision until potentially summer of 2021. The court has great leeway on when it decides to release its decisions. And this case involves whether the ACA is unconstitutional because Congress eliminated the tax penalty for failing to have health insurance. You may remember years ago, the first constitutional challenge to the ACA, a case called NFIB versus Sebelius. the Supreme Court held that the ACA was constitutional, specifically its mandate to have health insurance, because that was a valid use of Congress's taxing power. So if Congress subsequently took away that tax, the case questions whether or not the ACA is then valid. So this slide lays out three possible outcomes of the case. The Supreme Court could return the case to the appellate court to relitigate it. The court could agree with the lower court and overturn, strike down the ACA or parts of the ACA, or the court could decide that only that small portion, the portion about the individual mandate, is unconstitutional without the tax, and leave the vast majority of the ACA, 99% of the ACA, intact. So all the market reforms, all the different pieces, the Medicaid expansion, and other things that are in the ACA, such as generic biologics and a whole host of other public health provisions, would remain intact. And most observers believe that a majority of the justice signaled in those November oral arguments that that is the direction that they are leaning. So with that, I'll stop our presentation. As you can see, there's a lot happening, and a lot will continue to happen in healthcare. And we thank you for your time.
Thank you, Allison and Oliver. Would you like to hear more about our services? You can contact us via the form at the end of the webinar. You can also contact us directly here with this email address and phone number, and we hope to see you again. And if you're curious, we have one last slide which describes in a little bit more detail what our three different divisions do. We will send you the slides and the video at the conclusion of this webinar as well. Thank you again for attending.